The eicosanoids are autocoid. They're produced when and where they're needed. When we give them as drugs, they're promiscuous. They'll turn on each other's receptors. We can generally predict that systemically administered prostaglandins will cause diarrhea, GI cramping, and uterine cramping. I'll say that again. Prostaglandins, when given systemically as drugs, are going to cause diarrhea, GI cramping, and uterine cramping. Ding, ding, ding! To reiterate important points so far, prostaglandins are locally generated and rapidly degraded, so they produce autocoid responses. Production of specific prostaglandins occurs in specific tissues where the specific synthases are located. Similarly, the receptors are tissue-specific. The molecular structure of the prostaglandins are so similar, though, that when we give them systemically as drugs, they're promiscuous and they'll turn on each other's receptors. So, for example, if we give prostaglandin E2 to protect the GI tract, we can cause uterine contraction, which can lead to a miscarriage in a pregnant person. Just a couple of points to clarify understanding. Activation of phospholipase A2 is a rate-limiting step in prostaglandin synthesis. It's inhibited by glucocorticosteroids. After arachidonic acid is cleaved by PLA2, cyclooxygenase 1 and 2 catalyze initial steps in prostaglandin formation, with specific prostaglandin synthases found in specific tissues. Importantly, platelets express thromboxane synthase, so they produce the pro-aggregatory TXA2, at least when that SN2 position is occupied by an omega-6, while the vascular endothelium expresses prostacyclin synthase to produce antiplatelet aggregation and vasodilatory PGI2, also known as prostacyclin. Looking at this simpler graphic for prostanoid synthesis, there are two forms of cyclooxygenase that differ in structure, tissue location, activity, and function. Cyclooxygenase, or COX-1, is usually constitutively expressed to form products for housekeeping, things like GI mucus and bicarb, thromboxane A2. COX-2 expression is often induced by shear stress, tumor promoters, cytokines, etc., and it often causes inflammation. Prostanoids, again, have a very short half-life, so they function only locally when they're produced in the body. They're autocoids. This graphic shows how similar prostaglandin structures are. The substituents on or saturation of the 5-membered ring identifies the letter assigned, while the number of double bonds is indicated by the subscript numeral. For example, PGI2 has 2 double bonds in its fatty acid chain. Omega-N refers to the location of the first double bond from the omega or carboxylic acid end. The actions of prostaglandins at their specific receptors in their specific tissues determine the actions of the prostaglandins as drugs. The upcoming slides look at many of these actions in more detail, with particular attention to those seen in red: GI protection, secretion and motility, effects on platelets, and the ability to induce uterine contraction, which is great for parturition, but not so much for those suffering from severe menstrual cramps or menorrhagia. Other important functions include increasing sensitivity of nociceptors, causing pain, fever, immune stimulation, bone remodeling, and penile erection. Just as specific prostaglandins are produced by specific tissues express the prostaglandin receptors. The prostanoid receptors are G-protein coupled receptors. When we give systemic prostaglandins or their analogs as drugs, we remember that the drugs are going to activate all the receptor types that they can reach. This is important enough to mention again. Normally, the vascular endothelium produces prostacyclin to help prevent unnecessary platelet activation. In atherosclerosis and cardiovascular disease, the vascular endothelium is damaged and it can't produce enough prostacyclin, so platelets are activated, leading to thrombi, causing myocardial infarction, heart attack, or cerebral infarction, stroke. The balance is important. Prostaglandins play an important role in the kidney and renal vasculature. Both PGE2 and prostacyclin cause vasodilation of the afferent glomerular arteriole and vasa recta, VR at left, which increases pressure at the Bowman's capsule to promote filtration. Prostacyclin, remember, is produced by the vascular endothelium. It's both vasodilatory and anti-aggregant. PGE2 also plays an important role in that it decreases sodium and therefore water resorption in the collecting duct, CD at left. This promotes urine formation. Notably, in the gastrointestinal tract, prostaglandins are responsible for increased secretion of GI mucus and bicarb, roles that protect the stomach lining from erosion or ulceration. In addition to their protective effects, prostaglandins are pro-secretory through increased expression of chloride channels and pro-motility. As drugs, prostaglandins cause GI cramping and diarrhea. Increased motility plus increased secretion equals cramping and diarrhea. Prostaglandins are called prostaglandins because they were first isolated in the prostate. Prostaglandins are involved in spermatogenesis and sperm motility. Prostaglandin F2 alpha causes very powerful uterine contraction, menstrual cramps and contraction during labor, while PGE2 is thought to be responsible for menorrhagia. Near parturition, prostaglandins activate macrophages to release metalloproteinases that soften the cervix, known as cervical ripening, to allow the fetus to pass through the birth canal. In the fetus, prostaglandins maintain the patency of the ductus arteriosus, which is the vessel that shunts blood away from the lung while the fetus is in utero. Prostaglandin E1 is generated downstream from COX-1 constitutively for housekeeping functions, vasodilation, gastric protection, GI motility. But remember, these GI effects can lead to diarrhea and cramping. PGE2 and F2 cause menstrual cramping. COX-2 activation can also lead to the formation of prostaglandin E. In the cervix, prostaglandin E causes infiltration of the macrophages. The activation of matrix metalloproteinases leads to cervical ripening. Prostaglandin E2 is also implicated in the promotion of angiogenesis and neoplasia. The first drug we want to look at is L-Prostadil, generic name for a product known as Muse. It's used second line as an agent for erectile dysfunction. It's administered either as an intraurethral suppository or as an intracavernosal injection. The instructions for the suppository are seen on the slide. Importantly, the use of L-Prostadil for erectile dysfunction may lead to priapism, which is a medical emergency. L-Prostadil injection is also used to maintain the patency of the ductus arteriosus in neonates who require cardiovascular surgery after birth. These infants are placed on extracorporeal membrane oxygenation, ECMO. We don't want the ductus arteriosus to close in this case. Another drug is a PGE1 analog, lubiprostone, generic name for Amitiza. It's used to treat irritable bowel syndrome associated with constipation, IBS-C, and also for idiopathic constipation. It's going to activate the chloride C2 channel on the apical membrane of intestinal cells, and this will increase sodium and water secretion into the gut lumen. Its use in pregnancy hasn't been investigated. Misoprostol is a PGE1 analog that's given with COX-1 inhibitors, NSAIDs, to prevent GI erosion. It can also be inserted into the vagina to promote cervical ripening before labor induction. Combined with the progesterone antagonist mifepristone, misoprostol is a constituent of the abortion pill RU486. Misoprostol for GI protection is contraindicated in pregnancy because it can cause uterine contraction leading to miscarriage. Misoprostol causes significant GI cramping and diarrhea. Dinoprostone, also known as Cervidil or Prepidil, is available as a ribbon or intravaginal gel. It's used for cervical ripening, and it's also used to promote uterine contraction for induction of labor and to evacuate uterine content postpartum. Carbaprost, generic name for Hemabate, is a prostaglandin F2 alpha analog that produces profound uterine contractions to induce abortion and to control uterine bleeding postpartum. Uterine atony is a primary cause of postpartum hemorrhage. Adverse effects occur when systemically administered carbaprost activates off-target receptors, causing diarrhea, skin flushing, altered blood pressure, fever, and occasionally bronchospasm. Ophthalmic PGF2 alpha is used to treat open-angle glaucoma. Latanoprost, Zalatan, Travoprost, Travatan, and Bimatoprost, Lumigan. The PGF2 alpha is going to activate macrophages to release matrix metalloproteinases that remodel the extracellular matrix to improve uveoscleral outflow, in some cases even increasing outflow from the trabecular meshwork. This works only in open-angle glaucoma. Topical application can lead to irritated eyes, permanent change in eye color, and eyelash growth. Just a quick review of glaucoma. Closed angle, also known as angle closure or narrow angle glaucoma, is a less common type of glaucoma, and it's greatly impacted by drugs that cause mydriasis, because the dilation of the pupil blocks the canal of Schlemm. Open-angle glaucoma is more common, and it's more like a clogged drain. In this type of glaucoma, prostaglandins are effective. Bimatoprost is marketed as Latisse to promote eyelash growth. It can cause a permanent change in eye color because it stimulates production of melanin. It may also cause hair growth in other areas that contact the medication. Whoops! Let's summarize what we've said so far about eicosanoids. So with prostaglandins, they're going to cause uterine contraction, cramping, and cervical ripening. You can predict systemic prostaglandins are going to cause GI cramping, diarrhea. They're also going to increase bicarb and mucus secretion to protect against NSAIDs. They cause vasodilation, which can lead to postural hypotension, dizziness, tachycardia, edema, and headache. They maintain patency of the ductus arteriosus. They have mixed effects on platelet function with prostacyclin anti-aggregatory and thromboxane A2 pro-aggregatory. They're going to increase aqueous humor drainage, cause growth of eyelashes, and color changes to the iris. They may cause fever, inflammation, bronchospasm, and in the kidney they can cause sodium secretion and dilation of the afferent arteriole. In a bigger picture, we want to remember that omega-3 products are anti-inflammatory. When we increase omega-3 fats derived from linolenic acid in the diet, we can reduce inflammation.